Addressing the nation on the latest COVID-19 impact on Sunday night, President Cyril Ramaphosa expressed concern about the country's healthcare systems that was under pressure as COVID infections continue to rise. Gauteng remains the epicenter as the highly transmissible Delta variant grips the country.
While Gauteng accounts for more than half of new infections, infections are rapidly increasing in the Western Cape, in Limpopo, Northwest, KwaZulu-Natal, and in Mpumalanga. Our health system countrywide remains under pressure. By next week, daily hospital admissions across the country are likely to reach the levels observed during the peak of the first two waves.
South Africa recorded over 16,000 new COVID-19 infections in the last 24 hours. Gauteng, the Western Cape, and KwaZulu-Natal recorded the most cases, while the Northern Cape accounted for only 1% of new cases. With more than 2 million COVID-19 confirmed cases countrywide, the head of Gauteng Health says healthcare facilities are struggling to cope.
Both the public sector and the private sector have reached threshold in their bed capacity, especially in their high care units, and specifically the ICU beds are running full. At this point, we have a shortage of over 50 ICU beds or ventilated beds in both sectors. We are experiencing pressures, especially at Chris Hani Baragwanath Hospital, Helen Joseph Hospital, and then the Telemoirane Hospital.
The country has entered another 14 days of level 4 lockdown regulations to curb infections, but some stakeholders in the healthcare sector remain skeptical. The South African Medical Association says its biggest concern is the impact on hospitals.
There has been no change brought in by the 14 days of lockdown, which could be attributed to poor adherence to restrictions by the public and poor enforcement by law enforcement agencies. There's no point of extending the lockdown if it does not achieve what is needed. But certain restrictions may need to be continued or to remain in place so that we curb the rise of infection. Medical facilities and medical personnel are still extremely under pressure.
Healthcare workers who are on the front line of the war against COVID are under pressure both physically and mentally, especially in Gauteng.
It seems to be worse now with the third wave. The worst part is that while some of them are getting ill, some of them are just getting fatigued and stressed out. And we've lost some of them, which is quite painful. We're losing healthcare workers both in the front line and as well as in senior management.
Health unions are calling for more vaccinations.
We are very concerned about the well-being of nurses because there appears not to be a very clear plan at the moment. We need a clear plan from government to ensure that the vaccination program is rolled out effectively and seamlessly without any delays. But
the National Institute for Communicable Diseases says more than 64,289 deaths have been recorded so far. Health unions say without a solid plan to rapidly reduce the spiking COVID infection rate, the 14-day extension might be useless. Patricia Fasache, SABC News in Pretoria.